1 in 5 people in the United States, or 1 in 4 if you include addiction, have experienced a mental health issue. Mental health has been getting a lot of attention after the spate of mass shootings in the United States this year. Now the question is, will these incidents lead to a change in policy or treatment? CCTV's Ellen Scott reports from Washington.
Eddie, I'm going home.
You'd never know it by looking at her, but Mina Hubbard suffers from depression and an anxiety disorder.
When you tell people that you suffer from mental illness, they don't want to have anything to do with you. They think you're crazy.
A staggering 1 in 4 people in the U.S. are coping with a mental health or addiction issue. Hubbard has been getting help. She's been going to PRS, Psychiatric Rehabilitation Services, a day treatment program for the last couple of years.
I get a chance to talk to the counselor. Sometimes I get a chance to talk to my peers, and it feels comfortable because sometimes you need to talk and there's, sometimes there's somebody there that can relate to your situation.
6% of the population in the U.S. suffers from a serious mental illness. Sadly, all too often, we only hear about it after a tragedy, like the elementary school shooting in Newtown, Connecticut that claimed 28 lives, and a shooting rampage at the U.S. Navy Yard where 12 people were killed. Both gunmen suffered from a mental illness.
High-profile incidents of terrible tragedies like Newtown or Aurora, the silver lining is, can we get attention and then can we get action?
And progress has been made, including some new legislation in the works. The Excellence in Mental Health Act, which is now a bill in Congress with bipartisan support, would put a mental health facility in every community across the U.S. with 24/7 care. There's something known as the parity law now, which says insurance companies have to pay for mental health and addiction treatment the same way they do any physical illness.
Usually what we worry about for people with serious mental illness is that they are often victims of crime. Because they're less able in the acute state to cope and to manage, they are easily robbed, they're easily victimized through rape. It is very rare for someone with a mental illness to hurt somebody else.
The council says the biggest barrier for people with mental health issues isn't the stigma, but rather knowing where to get help and what help looks like.
When I first got diagnosed, I was like, wow, I had no idea, what was going on. And they was like, well, this is your illness. And I said, this is what I'm suffering from? And I had no idea.
The National Council hopes to educate the public on possible treatment centers and ways of coping with problems that can spiral out of control. Hopefully, it will be the start of a journey that can lead people on the road to recover, much like Mina Hubbard. Ellen Scott, CCTV.